We want to talk about where someone should go if they do have a psychiatric emergency. What do you guys think?
Well, as we have said before, although ERs are wonderful places, they're not always fully equipped to handle psychiatric emergencies. They don't always have psychiatrists on call in order to handle whatever happens. So we have, for example, centralized receiving facilities and all sorts of crisis units around town where they're better equipped for the patient to come in, get a full evaluation, and be able to get the treatment as quickly as possible versus going to an ER, having the patient transferred to a crisis unit, and delaying the treatment that would have been helpful at the moment.
So what's the process like for a patient who comes in?
Well, for example, for an outpatient setting, we try to extend our services to everyone. We will accept patients regardless of ability to pay, regardless of insurance. What we do is for patients that do not have insurance, have a sliding fee scale that is tied to your income and your household size. So the rates are extremely reasonable, and we want to make sure that these services are available to everyone who needs them. So we will not turn anyone away at any point. If you come in and you need to see a psychiatrist for whatever reason, or a therapist, we will welcome you. We will do a financial evaluation, and we will see you same-day appointments as well.
So what are the treatment options?
There are several treatment options. The outpatient is one of them, in which is if you're not having a major psychiatric active disorder, you can actually utilize outpatient services and get an evaluation immediately. If the psychiatrist determines that you need to be admitted, we do have our crisis service, crisis stabilization unit and next to the outpatient clinic. Now, if a major psychiatric emergency in which there is a potential for suicidal behavior, the individual becomes dangerous to himself or to others, or without the care will neglect his care and his well-being, can be immediately admitted to our crisis facility, which acts pretty much like a psychiatric inpatient unit, and start to get a complete evaluation, treatment started immediately, primary care services, identification of combination of medical problems, and treatment until they are stabilized, transferred after what becomes stabilized, transferred to an outpatient area for mental health services, and also a continuum of primary health care services. And if they or we identify a substance abuse problem, we tackle the whole thing at the same time. They will get treatment for psychiatric disorder, substance abuse, and primary care need.